So Katie, thank you so much for the opportunity. We're really excited to have this chance to kind of share with you what we have to offer here at the Pima County Health Department in terms of careers and some of the opportunities that are available. So we'll go ahead and I'll advance the slide here. So Katie kind of went over this, but I'll just reiterate it really quickly. So we'll have a quick panel discussion with two of our recent graduates and our current intern. They'll share a little bit about themselves and what their career journey has been up to this point and some of the things they're able to work on here at the health department. And then we can do a Q&A if you have questions about the things that they've been able to work on in their career and anything like that. Next, I'll talk a little bit about positions of interest to new graduates from the College of Public Health. And then I'll also talk about kind of the logistical process of applying for positions here at the health department. And then we can do a Q&A on the kind of technical side of the house. So, all right. So to get us started, I will introduce our three speakers. The first is Kelsey Camps. She is our Quality Improvement, Performance Improvement Program Manager. She's been with us for about 2 years now. And then we have Jadyn Butler, who is our Quality Improvement Program Improvement Program Coordinator. She is a previous part of the first cohort of paid AmeriCorps interns that we have had here in the department, and she has now joined us as a full-time employee. And then we have Sailor Hutton, who is one of our current AmeriCorps interns, who is just finishing up her year, her academic year with us, as well as she is also a athlete in the athletic department as well. So Kelsey, if you wanted to be the first to go to kind of tell us a little bit about your journey in public health and some of the things you're able to work on in the health department.
Yeah, thank you, Matt. Appreciate it. So yes, hi, my name is Kelsey Camps, and I work in our performance management area in our cross-functional operations division. So I started off at U of A in 2016 as like an undecided major, didn't know what I wanted to do. And then sophomore year, I kind of got exposed to public health because I was thrown around nursing or just other health related majors. And I kind of fell into it because my advisor was like, this is a safe, broad major, you should explore it. Turned out I ended up loving it. And I graduated in 2020 with my dual degrees, one in a Bachelor of Art in Spanish, because I also like Spanish and Hispanic literature, and then my BS in public health. So in 2020, I went straight into my master's to get my master's of public health as well. And I really enjoyed my graduate experience at U of A, even though 2020 through 2022 was a interesting time to be in grad school. I was definitely taking a lot of online classes. I still really enjoyed the engagement that the professors provided. My emphasis was health behavior, health promotion. So I'm really interested in program design and implementation and kind of looking how we can improve programs or how to improve health behavior through programs in our communities. So I knew I wanted to work at the health department or some form of that, be right into the community doing any sort of program implementation interventions. So when I graduated, I ended up applying to multiple places, kind of in the last semester up till graduation. And the health department was one of the areas I was interested in. So I applied to multiple positions and ended up in quality improvement due to some of my background experience with internships in my undergrad and my grad school. So when I was in undergrad, I was an intern for a few years at the YWCA Southern Arizona location. And I worked with a lot of CHWs, community health workers, and doing their curriculum improvement and also facilitating some of their classes, working with some Latina mothers and daughters in sexual health education. And then I also was a part of the Honors College in undergrad. And for those that are maybe a part of the Honors College, you know you have to do a thesis. So my thesis kind of was also with the YWCA, where I ended up co-designing a curriculum for trauma-informed care for CHWs. And that allowed me to pilot a program essentially. And then when I went into grad school, you have to do an internship as well. So I kind of trailed off of that current work and did some quality improvement where I interviewed folks, focus groups, did a survey and collected essentially a lot of qualitative data to look at. And that helped me build and improve the curriculum for a few years. And that program's still up and running at the YWCA. So that kind of kickstarted me into where I'm at today. When I started at Pima County Health Department in 2022, I was just a quality improvement coordinator. So now the team is performance improvement and quality improvement. But at the time, I was solely the quality improvement focus. So I got exposed to a lot of different programs in our health department where you work with different divisions that we have to look at how their program processes are operating and how we can improve them. It's pretty straightforward. So we have a quality and action committee that I facilitate, and now Jadyn also helps facilitate, where we have a committee at the health department of folks that are just interested in the topic as well. You can participate in professional development opportunities, such as getting certified in Lean Six Sigma, which is a improvement methodology or a framework that you can follow to actually measure improvement and make sure you're looping back to see if you were successful in the changes you made in your programs or whatever you have be at the organization. I've had the opportunity at the health department to attend and apply for multiple conferences. I submit abstracts and have presented recently at the American Society for Quality on Lean Six Sigma. So we brought a training program to the health department to get folks certified in yellow belt and green belt. It's a tiered training program. So definitely if you're at the health department, you have many opportunities like that as well, where a lot of folks are wanting to have you advance your skills while you're working as well, but get multiple certifications. So Lean Six Sigma is definitely one that we offer through our program. And yeah, I've been a part of us becoming reaccredited. We work closely with our strategic initiatives team. So we are an accredited health department, which is amazing. So being reaccredited is even better up until 2028. So we'll reapply then, and I'm sure we will be fine too. So lots of program improvement is involved in being a reaccredited organization as well. Yeah, and then I worked in my quality improvement coordinator position for a little over a year, and then I was recently promoted to become the performance improvement and quality improvement program manager. So I've been in this position for the past 6 months. I have an amazing team of 4 coordinators under me, and then an intern, AmeriCorps intern. So we're always having an AmeriCorps intern some form in our division, which is great. And yeah, I enjoy working every day with our current staff members. Everyone's really kind. Everyone's really obviously community focused, but for that reason, people are very sociable in the health department, and you make a lot of coworker friends, and people are just approachable that you can ask anyone questions or concerns, or just just enjoy your time while you're going to work essentially. So I think that's pretty much all I really wanted to hit on, unless we can save questions for the end, Matt, or I don't know if there's pauses, but yeah, that's pretty much my journey so far.
Thank you, Kelsey.
Yeah.
We appreciate it. Yeah, we'll kind of save questions until everybody until the end. So Jadyn, you are next up. If you want to share with us some of what you have been able or what you've been able to work out of the health department, and also kind of your journey, academic and professional journey to the health department.
Yeah, so hi everyone, my name is Jadyn, and I am one of the performance and quality improvement coordinators under Kelsey, as she mentioned. And I'm really excited to speak with you all today about my academic journey and what kind of led me here to the health department. So first of all, after high school, I was really committed to becoming a physician's assistant. That was what I had in mind. I wanted to pursue medicine. So I chose physiology as my major and Spanish as my minor, because I too was interested in Spanish. I took all 4 classes in high school. My mom's from Mexico, so I was like, I need to master this language. So I figured that would be a good route for me. But after a couple years and me discovering what I needed to do to get that required patient experience for a PA school, I decided to be an ER technician. So I kind of went about that track. I did an EMT class over the summer at the U of A, which was really fun, and I got to do a lot of hands-on practice, and I gained a lot of knowledge through that. But I realized being more on the individual level with health wasn't something that I was so much interested in overall. I decided I kind of wanted to be on more the population side of things. more like admin type. And then I decided physiology was just not the route for me. So I looked for other options and I found public health. And I figured if I still wanted to do PA school, this could still be an option, but this would open more doors and provide me with maybe some more options for jobs later on that I would not be aware of. So I made the switch and I chose public health. And that was really great. I loved the classes so much more. I found that I was drawn towards health disparities, particularly in minority communities, and those courses. And graduation was slowly creeping, and I was kind of stuck because I didn't really know what to do with this. So luckily, I got an email about an AmeriCorps intern position at the health department. It was a paid internship. We needed one for the program, and I was like, okay, well, I'm going to apply to this and see what happens. And luckily, after some patience and getting the interview, I finally heard back and I got a position for the performance and quality improvement intern. So yeah, that was really great. And it was kind of like a win-win for me because I had heard of AmeriCorps, but never like delved into that. So it was really cool that I could say that I was an AmeriCorps volunteer doing service at the health department. So I got benefits from both sides. And it was really cool too, because I got to do projects that were also passions of mine. So I wasn't doing busy work. A lot of it was really great resume building activities. So one of the main projects that I worked on was a menstrual health quality improvement project. And basically the main goal of this was to improve the methods in which the health department clinics, there's like 3 clinics, I believe, in which they were advertising and distributing menstrual hygiene products. So the various locations had different means of this. So there would be little brown bags of free menstrual hygiene supplies, or there would be containers in the restrooms for clients to take, but there was nothing that was standardized. So it was really cool. I got to work on an advertisement flyer that we got to post throughout the health department and the clinics. We were able to order more products and standardize the way that they were being distributed. And it was really great because through this, I was able to get my Lean Six Sigma yellow belt that Kelsey is mentioning. And now I'm able to grow in that in my role. I'm doing the green belt and hopefully soon the black belt. But yeah, I also got to write a formal report for this and then present the project to other staff members. So that was like a real good moment for me. And everyone was like super happy. And I was just glad that I could have that on my resume. I thought that was really cool. Yeah, some other things I liked too with my internship experience was that I was a part of different committees. And one of the big committees that I'm still in now is the Health Equity Steering Committee. The name changed around a little bit, but we did a lot of different like discussions, and we would watch TED Talks together about like microaggressions in the workplace or autism acceptance, things like that. And then we also got to draft a health equity glossary for the health department. So we went over like the different terms that we felt needed to be on there to kind of steer that. So that was cool because it also kind of tied into my desire of like making minority communities more health accessible, I guess we could say. So yeah, that was really cool. And then another thing too was having the ability to go to conferences, as Kelsey mentioned. Obviously, my role now, that's going to be an opportunity, but as an intern, I didn't think it was. So I got to go to the NACCHO 360 conference last year in Denver, and NACCHO is National Association of City and Council Health Officials. So they have a conference every year for like different local like health departments and health organizations and staff members can come present or do a poster, and AmeriCorps offered like an all paid experience for that. And we also got to partake in a presentation and just it was a really great learning experience overall. So I'm glad that continued on to my career here. But yeah, after I finished my internship, I graduated and I was hopeful that a position would come up. And when I got notified that one did, I applied, and I've been here since November. So it was a really nice, easy switch from my internship into the role. Yeah, and then to touch on to like the professional development skills, one of the ones that I've been able to dive into is PMP, so project management. That one is a really great, like, well-versed certification to have, as well as Lean Six Sigma. So a lot of things really opened my eyes when I was in the health department. I really didn't see it from this perspective. So I'm glad that I've been able to do all these different things, and I'm really enjoying it so far. But yeah, I think that's it for me.
All right, Jadyn, thank you very much. All right, and then for our third speaker, I'll turn it over to Sailor Hutton, who is one of our current AmeriCorps interns, and she's finishing up her term right now, and just completed a big project for us. So we're really excited that she'll be able to share a little bit about kind of what's led her here, and then also kind of what her experience has been with the health department.
Sailor, are you having trouble? I don't know. My cat just jumped on my keyboard, so I don't know if it's.
Can you
my
guys hear me now?
Yes.
Okay, good. Sorry about that. Okay, hello everyone. I'm Sailor Hutton. And like Matt said, I'm a current AmeriCorps member, interning here at the health department. And yeah, and I'm a current U of A Masters of Public Health student, so I'll graduate in a couple weeks with my Masters of Public Health in Health Behavior Health Promotion. So same as Kelsey here. But yeah, I did my undergrad at Boise State University. So I'm new to the state of Arizona for just been here for 2 years. So yeah, so I did my undergrad in health science. My emphasis was health informatics and information management. I thought I wanted to go more into like health information technology and like, like the electronic health record and just privacy of data. And so I thought that was pretty interesting. And I knew I always wanted to work in health, but I wasn't sure exactly where in healthcare. At first I thought, oh, maybe I'll go something clinical. But I realized I don't think the one-on-one patient and provider experience was for me, but I knew I wanted to do something in the healthcare field. And so I want to say my junior year of undergrad, I took a public health class. It was one of like the electives, and I was like, oh, that sounds interesting. And conveniently, that was kind of the end of COVID, was my junior year. And so we just started learning more about the public health topic, and I was like, oh, this is a really interesting topic that I'd like to learn more. And graduation was coming up, and I wasn't sure what I wanted to do. And so my advisor had suggested I should apply for a Master's of Public Health program somewhere. And so I wanted to stay in the West. And so U of A happened to be kind of in my wheelhouse. And so I moved down here to Arizona and started my program last year. Yeah, and I've loved my experience at U of A so far, and it's coming to an end, sadly, but a really fun experience. But anyway, as you all know, at U of A, we have to have like an internship experience at the end of our program. And as I was applying through the hub, I saw an AmeriCorps internship popped up, and the site was the health department. And so I was like, oh, that's great. Like, sounds like public health, sounds like a great opportunity. So I applied and waited a bit and heard back. And so I got an interview. But yeah, so I'm working with the cross-functional operations division, but specifically within employee training and development. And so that's the team here at the health department that, correct me if I'm wrong, but they do a lot of trainings and deal with some hiring of people. But yeah, so they do all of the background work for the employees, which is pretty cool. But yeah, my main role here was program or event planning for National Public Health Week, which is a celebration that the American Public Health Association puts on every year, the first week of April, which is kind of cool. It's a event for the full week where we just celebrate our public health workforce, basically, and what we do in our communities every day, yeah, to improve health and protect health. So that was my main role this year. And at the health department, we do it as like an internal celebration of, and we had opportunity for different areas within the health department to present their work, like different community outreach programs that exist. And yeah, so it was a really cool experience and just kind of an opportunity to get employees to kind of aware of what programs are going on within the health department, and just so like the different divisions could come together and celebrate their great work that they do here in Pima County. So yeah, was my role this year. And yeah, it was also a great opportunity for me to fulfill my internship requirements for the end of my school program. And so I was able to like implement a physical activity intervention, which I kind of wove that in with National Public Health Week. Yeah, so super cool opportunity, and something that I thought was pretty unique and cool to have like an internship here was that although I'm working with a specific team, employee training development, I do get exposure to like other divisions and other teams that are working on various projects. And so as an intern here, you do get access to that, and you can walk around and talk to anyone, or if you have questions about career stuff, you can always reach out to people. People are totally willing to talk with you and share their journey. So that's really cool. As an intern here, it's kind of you get out of it what you put into it. If you are curious about something and you want to be involved in a project, you can just ask, and people are more than willing to help you out. So yeah, that's all I have, but thank you.
All right, thank you, Sailor, very much. We appreciate it. All right, so now I'll open it up for questions. If anybody has any questions, go ahead, put it in the chat, and I will read it to our panelists. But to start it off, I do have a question for each of you. If you want to take kind of a stab at it, is what has been sort of an interesting perspective change, or something you kind of learned that you weren't expecting, or this is something that was just maybe a little surprising, that went going from kind of the academic setting of being a student to the practical setting of the workplace here at Pima County? Has there been sort of like a kind of a moment there was like, oh, this is kind of interesting putting this theory into practice, or anything like that? What is kind of a note of wisdom that you might be able to share with our current students?
Maybe I can jump in on that, Matt. That's a good question. I think for me, when I was studying public health and thinking about public health, I was like, okay, I'm gonna be hands-on in the community, working in a program, trying to address a specific health disparity and working with a lot of people every single day. But I didn't really consider all that goes into how these programs can be run and who is on the back end of making sure the logistics are in place. So operations is definitely something to consider when you're looking into different organizations you want to work at. Being a part of cross-functional operations at the health department is interesting because it's just that we cross-function with all of our different programs, but it's an internal focused division that helps support how we serve our community externally. So I didn't think I really wanted to be, necessarily internal, but I have come to learn a lot about myself as a result, because I knew I wanted to, address issues, but the problem solving aspect, whether it's in the community or it's on the back end, has really been something that I've held on to. So being in quality improvement, performance improvement, it's very administrative in a way where you're on the back end problem solving. So you don't always see the result at all times until the team and program loops back with you. But I've come to really enjoy it. And I think I've determined with myself that I didn't consider this aspect of public health, but I really like it. And I know that wherever else I go, I can still stay in the field of public health, but every organization needs that team that's doing the logistics, that's running the operations, or it is more administrative, generating reports and results. So something to consider as well. If you are not as social or don't want to be as community focused, you can still work in public health in a lot of administrative roles where you still get to support your community through a different avenue in a way. So yeah, that's something that I came to learn about public health. I knew administrative programs and activities existed in public health. There's a whole master's like focus you can have in it, but I didn't truly grasp what it was, I guess, until I started working here. So definitely something to consider if you are interested.
Excellent. Thank you, Kelsey. Jadyn or Sailor, do you want to, anything you wanted to add?
Yeah, I was just gonna piggyback off Kelsey. I didn't really go into public health, especially the health department, thinking that there was this like CFO cross-functional side to things. But honestly, like this is where I want to be, because I was also considering maybe the business route, you know. So having this opportunity to touch into that space a little bit was really cool. And yeah, like working on a specific program was interesting, but being more on like the back end side, as Kelsey said, and being able to work with various different programs, I'm actually seeing others I didn't think about before, and I'm able to learn about what each do. So that's just a skill in itself. So yeah.
Thank you.
Yeah, I agree with both. I think that just the internship here has kind of opened my eyes to the administrative side of public health. I feel like my course load really prepared me to be out in the community and like working with populations. Like through this program, I've done a lot with school health and just like working out in the community. And so this was definitely a different role for me and a new environment for me. Working in an office-based setting, in meetings, and just more of an administrative role. But yeah, it's definitely opened my eyes to public health is much more than just being out in the community. There has to be that team in the background working to create those programs and just ensure that they're being successful and doing what they need to be done. So yeah.
Excellent. Thank you very much. All right, we have time for, if there are any, a few more questions, you can either come off mute or put them in the chat for our three panelists. All right, well, if not, I would want to thank you guys so much for taking the time to share with our students your career journey, your academic journey, and what you've learned and what you've wanted to kind of share out as kind of a helpful perspective. So thank you very much. We appreciate it. And then we are going to shift gears a little bit now in sort of the logistical side of applying for jobs and working in the health department. So here we go. So here are some positions of interest. The bold ones are kind of the ones that are kind of the first, like you have graduated with either a bachelor's degree or your MPH and are looking for positions, sort of the first full-time position out of college, or once you've completed a degree. So cuticle disease investigators. So these, we have folks that track tuberculosis, AIDS, HIV, other ones, there's a whole, our epidemiologists track over 90 diseases. So these are folks that, again, interview folks who have or have come in contact with a specific disease. They do different work related to that. We have environmental health specialists. These are folks that do restaurant inspections that make sure that restaurants are complying with what FDA standards to serve safe food. Our epidemiologists, many of you probably are concentrating in epidemiology. So these are folks that interface with the hospitals, the various clinics, and track diseases all throughout the county. And then depending on the severity of the disease, obviously report out to the state health department or the CDC. And then also just create a lot of disease modeling as well. Business intelligence analysts, these are folks that are kind of our data folks who analyze different trends in diseases, whether communicable or not, things if it's not Google, things of think of something like hypertension. Like Pima County is above average on hypertension rates compared to the national average. So they do a lot of different modeling related to that too. The ones that are not in bold are ones that, depending on your background, depending on how many years you might have worked between your bachelor's degree and MPH, if you're getting an MPH, these are ones that might be of interest to you. Again, yeah, depending on how long you've spent in the workforce. The physician, I pulled out the physician dentist one, just because it's kind of like, what is that? But also, depending on any type of dual program you might be enrolled, because one of our other AmeriCorps, she is getting her MPH and her MD position. So this is kind of would be an ideal one for her, because this position is sort of our assistant chief medical officer for the department. So they would be in charge of all of our medical services and planning for all of that. So again, depending on your totality of your professional background, some of these other ones might be interesting as well. We still have some more. Our public health informatics and data analyst one. So these are also folks that do a lot of work with our data. The health department generates a lot of data, and we need to put that into a usable format for policymakers and for the general public. We have a policy analyst one. So these are folks that help track state and federal legislation about how different rules, regulations, laws would affect public health outcomes in Pima County. So right now we have folks tracking the state legislative session to see what bills are introduced that would affect public health, and if they do become law, how we would have to comport or change to comply with that. Public health program coordinator. So that position is actually the one that both Kelsey and Jadyn started with, right, coming from MESCOF. So that's one that you'll see quite a bit. It is a little bit of a catch-all job description, because a lot of different areas of the health department have program coordinators. So it just kind of depends on what that might be. So we have folks that do emergency preparedness. We have some program coordinators in that area, community outreach, a whole variety of things. So that's one that you might be interested in. And then a public health program specialist. Also, again, it's a little bit of a catch-all, and they're kind of all over the department. But yeah, and then some of the other positions, again, depending on your the totality of your professional and academic background, might be interesting as well. So when you look for jobs, and I will show you on the next slide where to find them, those are some to keep in mind as you do your search. All right, how to apply. So first you have to find the positions that are open. There's a couple ways to do that. There's a QR code that will take you to all the open positions right now as we speak. There's the website link there, and then also the kind of at the bottom of the screen here, there's a link to all of the jobs right on the Pima County homepage, which is pima.gov. All right. So one of the things, as you browse the job listings that we have, if you find one you want to apply for, you will have to create a profile in NeoGov, which is the Pima County's overall our applicant tracking system. Excuse me. So you only have to create a profile once, and you only have to upload your data once, but you can edit it as needed. So if there are multiple positions that you're interested in, you can tailor the profile to the position that you're interested in to make it more applicable. Excuse me. So once you've selected your desired position, and you can apply for more than one at a time, you can, like I said, go ahead and edit it as needed to be more applicable. Just some words of warning: the system can be cumbersome. The system that the county uses does doesn't have the smart technology to just take your resume and import it into the software, you do have to do that. Again, apologies in advance. It's just kind of one of the nuances of the system that the county uses. But again, you just have to, once you create the profile, only have to do that once. So next, excuse me. So I wanted to share with you some application tips. It's our system can be a little janky at times. I'll just say that. So to give yourself the best chance is when you look at a job posting, please go ahead and make sure that your terminology on your application and resume matches the terminology of the job posting. So one of the examples that I like to share is, let's say you have the position wants you to have teaching experience, but you have coaching experience. The system won't equate that. So in that case, you might want to say you taught basketball instead of coached basketball. So that's just kind of one example of how you kind of want to be as specific as possible. And that especially true for the minimum qualifications, because the system, the computer, it's just a computer system that validates the minimum qualifications. No human actually looks at that. So that's really important. And then the next part is the preferred qualifications of a position. So you want to just kind of make it as clear as possible that your experience is relevant, because in this case, someone is reviewing these, the hiring manager is reviewing these. So you just kind of want to make it as easy for them as possible. So just kind of put yourself in that position of someone reviewing applications. How would this be as clear as I can make it? The next point I wanted to make is include on your resume as much as you can, because there's a few things for this. You don't want to sell yourself short. You don't want to, take yourself out of the running or anything like that, because everything you've done up to the point of applying to the job is relevant, and it does matter. And everybody brings their entire selves to the job, so you want to include as much of yourself as you can. An example of this that might make a little bit more clear is, some of our job postings might say, fast-paced environment, for example. And if you worked in a fast-paced environment while you were getting your degree, or in high school even, so like a restaurant might be a fast-paced environment, but include that because it does matter, and it is relevant experience. So like I said, don't sell yourself short, and include as much as you can, even if it seems non-relevant and if it's unpaid. So if you did an internship that was unpaid, include that as well, because that is experience, and you did learn from it. So do include that. All right. Next, we have something really exciting, because everybody on this call is this webinar is the first to learn about this. Liz, do you want to talk about next year's AmeriCorps internships?
Yes. So our upcoming cohort of interns, we're going to have 11 paid internships available for the next academic year. So it's going to be starting September, just after Labor Day, and then ending in May around Memorial Day. So it's going to total 675 hours. And the applications are officially online and available for you. So this is hot off the press. You're the first ones to hear it, and those will get sent out today and hopefully go up to the hub. And you'll be able to look, each position has its own description. And then when you go to apply, and I will drop that link for you, you're going to only apply one time. So if you're interested in more than one position, you're going to submit one application, and then you'll have the opportunity on there to select from your top 2 positions that you're most interested in. So the applications are going to be due by June 14th. And then from there, we'll be sending those out to make selections. And so they're across all of the divisions within the health department. So some up in the cross-functional operations area, some that are more in like that consumer health and food safety, and some of the other programs that we have. So depending on what your interests are, it kind of covers everything that you could possibly be interested in at the health department. So those are coming out soon, and I will share that link with you. The application does not have the position description, so you'll still want to go to the hub to look for those, so you can kind of get an idea of what you might be interested in. The other thing I'll mention too, that Kelsey mentioned in the chat as well, is that we do have paid summer internships. Those are closed for this summer, but those should be coming again next summer. So depending on where you're at in your academic journey, that can be something to also keep in the back of your mind, that those will come out again next year.
Yes,
Yeah,
so,
so any questions?
yeah, so thank you, Liz. Yeah, no, this is really exciting. And again, this is year 3 of our AmeriCorps internships. And it's been a great success both for our students who have partaken, and as well as our programs here. Everybody we've gotten from MESCOF has been incredibly valuable to the organization. We had, as just an anecdote of kind of the opportunities it could potentially lead to, one of our interns the first year, which I guess is still technically last year, she was invited to participate in the 30th anniversary of AmeriCorps at the Clinton Library in Arkansas, and she participated in a presentation with former President Clinton. And she spoke about her experience at the Pima County Health Department. So we have the health department now, and these internships now have a wide reach. So yeah, so I would encourage you, if you're interested, to apply. Liz just put the link in the chat. If you have any questions, you can reach out to Liz or I. I was looking at the chat, and I think most of the questions got answered. There might have been some questions about where jobs are posted. So for jobs, like full-time regular positions, and the summer internships that are now closed, so they're not posted there anymore, is on the website, the Pima County government jobs website. And that gets updated every Friday. So go ahead and check fairly regularly if you are interested, just kind of see what positions are open. And then the summer internships were posted there as well, and they will be posted there next summer. But for these internships, since they're just geared towards students, they will be posted to MESCOF. I think it's the hub is what it's called. So it will be posted there.
I just shared the link to the hub in the chat. And so that's hub.coph.arizona.edu. So that's within the College of Public Health. And then I also shared, if you as a U of A, MESCOF student need assistance in kind of connecting or navigating, you can certainly come to me too. So I shared the link to the Community Engagement and Outreach Academic Health Department's page within the College of Public Health too. So if you are looking for something one place and don't see it there, just come to me and I can also help you find it. And then there is actually a really interesting question here about the opportunities for international PhD students for the summer. So I think maybe this has 2 parts, and one is that we've had several people on here talking about that they're PhD students, which the internship aspect You know, I believe there's not like a required internship for the PhD part. I know I did my internship as an MPH student, but I think by the time you're a PhD, often that's not, you know, a part of your program of studies. And then, so I think specifically for Pima County Health Department, maybe you guys can like speak a little bit to PhD students and opportunities for them. And then the other piece is, you know, international students and where they fit in, and particularly with the AmeriCorps, the AmeriCorps internship opportunities, because I'm assuming that they don't get sponsorship, but I don't really know how that works either.
Yes.
So if you look at the AmeriCorps positions, there are a couple that are a little more specific about the educational requirements. One of them, they're looking specifically for a graduate student, and that can be master's or PhD. And then there is one that they want to have a junior or higher getting their bachelor's, so at least in their third year of undergrad by the time they're starting their internship for this upcoming academic year. The rest of them just require college enrollment or completion at bachelor's, master's, or PhD level. And so that's listed in all of those positions. And then those two that I mentioned that are a little bit more specific are bolded in there in the job description or intern positions.
Just for clarification, so the AmeriCorps opportunities, are they internships that are only for students, or I know this is maybe related to the question Chidera asks is can you apply for an internship position for September 2024 to May 2025 if you're graduating in May 2024? So yeah, I guess especially with the AmeriCorps, if you can give clarification, are they looking sometimes for degrees that have been completed in those opportunities? And then do they still need to be a student as well?
I'll defer to you, Matt, if there's anything that you have to say otherwise, but the way that it reads, you could have already completed your education, I believe. Do you know that?
Yeah, there's on the AmeriCorps side, so the I guess one component to the AmeriCorps program that I'll kind of point out really quickly is that it's it's kind of three parties. So it's the health department, MESCOP, or any other potential college at the U of A, and Arizona Serve, which is the folks that administer the AmeriCorps program here in Pima County. So according to them, I know you don't have to be currently enrolled in college or an academic institution while you do your AmeriCorps. So you could have that wouldn't preclude anybody. I don't know. I saw there was a question about international students. I know it's not really applicable right now because it's now closed, but for the paid summer internships, we have in the past, but generally because it takes a long time to get through some of the paperwork, it's not as the internship will be like halfway over by the time we get through all of that. So that's not it's just logistically it's just a little challenging. And then that's a question that I actually don't know on the AmeriCorps side if they have any provisions about international students. And then generally, if there is always an option for someone to intern with us that is not a paid position, in that case, yeah, that wouldn't be a problem at all. So an international student interning with us that happens to not be for compensation, that's totally fine. So hopefully I was able to touch on all of those things.
Yeah, I know Chidra also raised her hand, so we can certainly take we still have a few more minutes left. But yeah, we can certainly take that question if anyone else wants to, raise their hand or unmute themselves if you have ongoing questions. Again, if there's I've actually worked with international student advising before, and so I'm happy to help if you have a particularly confusing case or complicated case. I can kind of reach out to different, the different players involved and try and do some troubleshooting and try and figure that out. So, we do have, because of this academic health department, we have a direct line of communication. And so definitely use it. If you have questions, you can reach out to me, Katie Careaga, within the college. And I can then, reach out to Pima County Health Department, to Liz or to AmeriCorps or whatever, so we can, start to figure it out. But always with international students, the buzzword is just start early, because it's gonna take longer to figure it out. So yeah, Chidra, did you have another question? Is she still there? I think she might have gotten off. Maybe she had to run to a different meeting. So, all right.
There's one more hand raised, I think.
That's not her, it's somebody else. Anyone have any other questions? Just, you can unmute yourself.
Yeah, yeah, I have my hand raised.
Yeah.
I'm the one. Yeah.
Oh, there's
I
two,
just wanted-
yeah, I see two people now.
Okay. I'm the one asking the question about the international students. You said we should reach out to you. First, I'll please like to know who do we reach out to?
Hey,
Yes, and then I can start from there. Thank you.
Sorry, I didn't hear, there was like a background noise, but my name is Katie Careaga. I am within the College of Public Health, and I am the academic health department's coordinator. So my email is kcareaga at arizona.edu. The link in the chat to our academic health departments also has my contact information there. So you don't have to reach out to me first, but if you still have questions about your own kind of particular situation, and it's kind of past beyond the bounds of this call, you're welcome to reach out to me. Like I said, it's just we can do more to help you, the more in advance that is. That's all. Yeah.
well,
And then
just wanted to say thank you to everybody. Here's my email if anybody has any questions, especially about any positions that are currently posted, that you have questions about, any other follow-up questions about applying for a position. And then Liz, if you wanted to put your email in the chat if people wanted to reach out to you. And then you can also, if you have any questions, follow-up questions for our panelists about their experience, let me know and I can put you in touch with them. So I appreciate it. Yeah, so I thank everybody for coming. And then if there aren't any last minute questions, I think that it might be, there's one more in the chat from Kristen. I guess while internships have deadlines, you can still. Yeah, so Christian, if you see a job that's currently posted on that website that the QR code took you to, or the URL, yes, it's available for it's open and currently available.
yeah. Yeah, great. Thank you so much for everyone who's participated and to our panelists. It's been very informative. I know I've learned something, and I think we've all hopefully learned something. And yeah. Oh,
Thank you.
thank you. Yeah, like I said, the video will be available on YouTube. So look for that if you need to recap or, need to look for our contact information, or, share that with other people too. So I hope it's been helpful, and thanks so much. Have a great day.